Hi guys, for today's webcast we're going to discuss the heart conducting system, which is a system that allows your heart to contract in the right order. So first off, this is a system of specialized cardiac muscle cells that generate and carry electrical impulses that signal the heart to contract and to contract in the right order. This system is also responsible for setting the basic heart rate, setting your basic heart rate. So let's start with a pretty rudimentary sketch here of systems of the heart. So we can draw that a little bigger here. Or the chambers of the heart. So we'll draw the two atrium here. Like I said, this is going to be rudimentary. And the two ventricles down here. We've got the interventricular septum here. So we've got a left atrium, a left ventricle. Remember, we're looking at the heart, and so that's why there's a reversed right atrium and right ventricle. Just as a quick review, remember that blood comes in from the vena cava, into the right atrium, gets pumped from the right atrium into the right ventricle, from the right ventricle out through the pulmonary trunk and into pulmonary arteries, heading towards the lung where the blood gets oxygenated. That's bilaterally. And then on the way back, it comes through. After it's been oxygenated, it comes through the pulmonary veins back into the left atrium, and then is pumped into the left ventricle, and then pumped out through your aorta. So we'll draw the aorta coming out. This is coming out from the left ventricle. Aorta. That's the flow of blood. What we're going to talk about is the conducting system. So, let's get started on that. The first part of it is going to be the SA node. The SA node, or sinoatrial node. So we'll draw that as a circle right here. This is the SA node. This is going to be the beginning of the contractile motion of the heart. And this generates, it goes at about 70 to 80 impulses a minute. Imp per minute. That's going to cause both your atrium to contract, and it's going to communicate from the right atrium to the left atrium via gap junctions. So I'm going to write that in the same color here. This is gap junctions. These are very quick communication methods, right? You want the atrium to beat at the same time and the ventricles to beat at the same time. So this is going to create electrical impulses and cause the two atrium to contract at the same time. It's also going to signal through the AV node, or atrioventricular node, which we'll just draw right here, make it a different color. This is the AV node, to begin the conduction system for the ventricles to contract. So we'll begin our path. So we'll start a list here of our conducting zone, conducting system. So we've got the SA node. SA node. I'm going to include gap junctions. It's part of it. Gap junctions. Move on to the AV node. From the AV node, it's going to the signal is going to propagate from the atrium down to the the apex of the heart. And it's important to know that the atrioventricular sulcus is not able to pass conduction through them. So if you were able to conduct straight from the right atrium to the right ventricle, you wouldn't get the proper delay, and things would just start contracting all at once, and you can imagine that'd be a bad thing. So the only communication, the only propagation of signal that can happen from the SA node down to the ventricles is through this AV node. And that's going to be through a bundle of fibers known as the bundle of His, or your book now just describes it as the AV bundle. So that's what I'm going to describe it as. So this is going to come down here into the interventricular septum. Pick a different color since things are getting kind of tight here. Into the atrioventricular septum, and we've got now the AV bundle. AV bundle. Or bundle of His, if that's what we've already discussed that as in class. Then we're going to break off into the right and left bundle branches. So we're going to have a right bundle branch, a right bundle branch, and a left bundle branch. And from there we're going to move into Purkinje fibers. Purkinje fibers. So we'll pick this color. And the way this system is designed is to make sure that the heart begins its contraction from the apex, which is down here. This is the apex. Apex of heart. And that's so that you have all of your contractile forces going up. You don't want blood pooling up at the bottom. You want to eject that blood out either through the pulmonary trunk or the aorta. So having this electrical conduction come all the way down through these Purkinje fibers ensures that you're going to get this contraction from the bottom up. So we'll walk through that conduction system really quick here. Remember, the SA node produces 70 to 80 impulses per minute, and that's going to, when that contraction occurs, both the atrium are going to contract at the same time, and that's going to be facilitated through gap junctions. Then an electrical signal is going to signal through the AV node, which is going to cause just a little bit of a delay until it goes through the AV bundle or bundle of His, then down through the bundle branches. These are bundle branches. We've got a right bundle branch and a left bundle branch. And then down through to the Purkinje fibers, where the actual contraction is going to start for the ventricles. Purkinje fibers. Purkinje fibers. I'm bleeding off the bottom there just a little bit. So AV bundle, then bundle branches, and then Purkinje fibers. And everything before these Purkinje fibers are actually going to be just, they're small but regular cardiac muscle cells. So it's going to be essentially the same cells that you find in the rest of the heart, but they're going to be smaller. And then those Purkinje fibers are actually going to vary slightly, and those are going to be they're specifically designed to carry that conductile force, or that for conduction, and not so much for contraction. They're really just to signal the other cells to contract. So these all fall into one category of cell, and then these are going to be more specialized. So regular muscle, cardiac muscle cells, cardiac muscle cells. These are more specialized cardiac muscle cells. They're going to be referred to as Purkinje myocytes, or specialized cardiac muscle cells. And we'll label those as Purkinje myocytes. Alright, I think I've covered everything that I'm supposed to here, and so we'll talk to you guys again in a few days.